Welcome to Health Sciences Update. I'm DeWald, Chancellor of WSU Health Sciences Spokane. Today I'm joined by 4 of our preeminent research scholars. Today we have Dr. Hans van Dongen, Dr. Dedra Buchwald, Dr. Marcos Frank, and Dr. John Roll here to tell you a little bit about their research, its benefit to society, and then where they see it going in the future. John, if you wouldn't mind, could you please tell us a little bit about yourself, your research, and what motivates you to do that research?
Sure. Thanks, Daryl. So my name is John Roll. I'm the Vice Dean of Research for the Elson S. Floyd College of Medicine and the Associate Vice President for Health Sciences Research at Washington State University. I've been on the Spokane campus for 16 years, and I've had the privilege of helping to hire everybody around this table. So that's probably one of my greatest accomplishments, one that I'm the proudest of. My research is in the field of addiction. We study how to understand addiction, treat addiction, and prevent addiction. When I started off my career as a scientist, I was really interested in about how behavior and time interact. I had all sorts of lofty theoretical ideas I wanted to study. And then I was doing a trial as a postdoctoral fellow at the University of Vermont. And a participant in that study, which was a study of people who smoked cigarettes and had schizophrenia, a participant in that study that I was working with was the exact same age as me. We were dressed the same. I got to talking with him one evening when I was collecting some data, and I realized that we had almost essentially the exact same aspirations in our life. We wanted to have families, we wanted to get married, we wanted to have jobs and engage in leisure activities. But it was clear to me in the moment that the path to realizing those aspirations were a lot easier for me than they were for him, through no fault of his own. And I can remember it like it was yesterday. At that moment, my more theoretically inclined research took a huge turn to a more applied focus on how people use drugs, how that interacts with chronic health conditions, both physical and mental.
That is great. So Marcos, if you wouldn't mind.
So I'm Marcos Frank. I'm the Chair of Biomedical Sciences in the College of Medicine. I'm a neuroscientist by training, and I'm interested in very fundamental, unanswered questions about the brain. How does the brain learn and store information? What happens to the brain in early life? How does it develop? How does it change as we age? What happens when the brain is diseased? And how can we find new cures to solve these problems? What are the roles of different brain cells in these processes? And a core area of my research is to understand how sleep interacts with these questions, because sleep itself is a fundamental basic mystery in the field. It impacts many systems, including the brain. We think it's involved in all these questions that I just listed. How did I get involved in all this? I think my answer is pretty simple. I was always a child that had a great fascination for nature and always had loved to try to solve puzzles. And the biggest puzzles that I can find involve the brain. And that's what brought me to my field and ultimately brought me here to WSU.
Excellent. Dr. Buchwald, if you would tell us about yourself.
Yes, I'm Dedra Buchwald, and I am trained as a physician and an epidemiologist. I am a professor in the College of Medicine, and I also direct a unit called the Initiative for Research and Education to Advance Community Health. So you can probably guess from the title that I do a lot of work in communities, primarily underserved communities, and in this state that encompasses both rural populations, also American Indian, and to some extent Latino and other underserved populations that don't seem to get the health care that they need. Our work, like John's, focuses across a variety of different areas, including prevention of disease, detection of disease, treatment of disease. And we do a lot of what's called clinical trials. And that is basically comparing whether one treatment or one approach is better than another for typically common problems like diabetes and hypertension, high blood pressure, opioid use, a lot of very common problems that are often much more common in these underserved populations. I came to do this work because my parents came over after World War II on a boat, and they each had a suitcase in their hand. And when I grew up, we lived in an attic, and then we lived in a blue-collar area. So my parents always told me the way up is to get an education, but never forget the kind of people that are in need around you. And so it's always been a driver for me to serve the underserved.
Thank you very much. Dr. Van Dongen.
My name is Hans van Dongen. I'm the director of the Sleep and Performance Research Center here at Washington State University and a professor in the Elson S. Floyd College of Medicine. My research is on sleep. I'm a sleep researcher, which means I study the effects of that sleep has on the brain and the body, and importantly, the effects that not getting the sleep that you need will have on the brain and on the body. And that ranges from performance and safety issues to long-term health. And I got into this research actually from a background of astrophysics. My training is astrophysics, and you might ask rightfully, how does that connect? I studied astrophysics because I was interested in learning a whole bunch of things about nature, from basic physics and mathematics to chemistry and biology, and all those things are what you need to learn when you want to study astrophysics. And then it was quite clear to me that I probably wasn't going to be an astrophysicist, but I could basically, with that know-how that I learned in my studies, I could harness any field that I would put my mind to. At least that was the plan. And I stumbled upon research on the biological clock. And it turns out that the same equations that describe a binary star system, say, also will describe the biological clock. And so I had a foothold into a new area that what I started to explore. And from that research on the biological clock, I then got into sleep research, which is closely related. And then when I made the jump to the United States, because I was originally in the Netherlands, and I got my an opportunity to do research on sleep deprivation, then my career really took off, because then all the kinds of opportunities that I've been given here really amplified themselves. It was awesome.
Excellent. Well, all four of you have been incredibly successful by any measure that we have in higher education. You've published many papers, you've trained students, you've been involved in the process of scoring grants where you've submitted proposals, and all of you have received millions of dollars in grants. But what I find impressive about what you do is your work has impact on our society. It has a lot of positive impact. So if you wouldn't mind, take a minute and talk about that. And Dr. Buchwald, if you would maybe begin this, what are the benefits of the research that you're doing to society?
Well, I think there's a couple of benefits. As I mentioned, we do work in the community. And there's a famous diagram that I'm familiar with as an epidemiologist, and it shows that for every 1,000 people that live in any community, only one is seen in an academic medical center. And so unless you study the other 999 people, you will not know what the problems are that afflict the majority of people. And that includes, of course, the underserved and the impoverished. So I think one of the benefits of the work we do is that we are in the community, and we work directly with community members on the things, the priorities they have, and the issues that they want to address. So I think that is a benefit to society because it encompasses most of the people in the society. We also address common problems, as I mentioned, problems like diabetes, like hypertension, debilitating problems like stroke and Alzheimer's disease, conditions that affect every family and every community. And I think the third thing I think is important to mention is that we also have training programs, and one of the things we try to do is link education with research so that they become integrated and not sort of very separate, siloed activities. And why does that matter? Because we train a lot of people who come from underserved minority backgrounds, particularly American Indians and Alaska Natives, and we train these people to go back to their communities and to do this same kind of clinical work. So it's a it's a legacy, it's an extension of the work that we do.
That is excellent, and it really does help us understand more of what you do and why you do it. Hans, if you would please describe a little bit of how you see your work benefiting society.
Yeah, so for a sleep researcher, that is an easy question to answer because I think we probably could all do with a little bit more sleep than we actually get. And we know that the implications of not getting enough sleep are far-reaching, ranging from simple things like making more errors or being a little less attentive than you might want to be, to actually putting yourself in harm's way when you're driving with insufficient sleep and might fall asleep behind the wheel, or managing safety-sensitive equipment and put people in danger because of a factory or a mining operation or a plane not being operated properly because of sleep loss. There are long-term health consequences with people that are involved in shift work being at increased risk of metabolic disorders, of increased risk of cancer, cardiovascular disease, and a host of other chronic disorders. And my research and the research of the people that work with me, not to forget, because most of the research is done by junior colleagues that are making careers in this area as well, and that I have the fortune to work with. That research seeks to find, first of all, understand why this happens, and secondly, how do you solve it? And to give you a bit of a sense of the impact of what we can accomplish when we solve these issues that are associated with not getting enough sleep, it's estimated for the US economy on an annual basis, the cost of people not getting enough sleep is in the order of $250 billion every year. And I'm not going to say that we can make all those costs go away, but if we can just chip away a little bit of it, then that has an impact for the US economy. But more importantly, if we can save lives by making sure that people are protected from safety issues that they might incur when they're not getting enough sleep, or if we can improve their long-term health by solving the issues that might happen to them when they're like a shift worker or a frequent traveler across time zones, I think then that has a massive impact on a personal level and on a society level, and that makes it worthwhile.
That is very interesting, and I would say all four of you, I know, you really reach society in different ways and you benefit society with your research. So we'll shift gears a little bit. John, would you talk to us?
Thanks. As I said, my area of expertise is addiction and addictive behavior, and those are problems that are as old as human history. If you read some of the earliest texts, they speak about issues of addiction, which is unfortunate because it's a condition that probably could be prevented if we could engineer the right strategies. I think the fact that this is with humans, has been with humanity for so long, has such detrimental impacts on individuals' health, tears families apart, tears communities apart, that anything we can do to address those really seemingly intractable problems has a huge benefit on society. Some of the things that we are doing now that I'm most excited about are work we've done when we started the Rural Mental Health and Substance Abuse Treatment Center a number of years ago to educate physicians in rural communities how to address the co-occurrence of addiction and pain. Dedra was part of that with me. Right now, several of my colleagues have some exciting work on neonatal abstinence syndrome. How do we address the impact of opiate use when a person's pregnant and what that has on a baby, the most innocent of victims of the opioid epidemic? All of these things, I think, have tremendous potential. We also do a fair amount of work on legal drugs like nicotine. We partnered with the Spokane Regional Health District a number of years ago to look at what the actual constituents are in e-cigarette nicotine solutions, public health issues around that. And like both of my friends Hans and Dedra have said previously, the people we train, I think, are going to have a much bigger impact on society than I'm ever going to have. I've got some tremendous colleagues who've been with me for a number of years, Dr. Marion Wilson, Dr. Sterling McPherson, Dr. Barbosa Leiker, Dr. Mike McDonald, who are really taking this work to the next level. And they let me hang out with them sometimes, but really it's their story now.
Very good. So, Marcos, if you would tell us a little bit about your work.
Well, I'm probably the most I would put it, fundamental scientist at the table, because the bulk of my research is not addressed at a particular disease or questions related to a particular disease, but fundamental questions about how the brain operates. And it's very important that we have this as part of the research environment, to ask fundamental questions about how nature works. It's through that that much discovery happens. As I say, the engine for new discoveries and new cures comes from where you least expect it sometimes, when you ask the right question. Having said that, a lot of the things that we're working on now have direct impact or can have direct impact on society. For example, there are two sides of a very bad coin right now in the brain. On the one hand, we have neurodevelopmental disorders such as autism, which are being diagnosed at higher rates in the United States, for example. We don't understand the neurobiological basis of autism. On the other hand, as our population ages, the prevalence of neurodegenerative diseases such as Alzheimer's is on the rise. We do not understand what causes Alzheimer's, and we have no cure for diseases like Alzheimer's. So the potential impact on both sides of the human experience, both early in life and later in life, our research impacts both of those ends, potentially.
Very good. And I would say, as a scientist, I can access an understanding of how good you are at identifying problems and then solving problems. So next, I'd like for you to explore a little bit about what you see in the future. What are some of the areas that you see your research moving into, kind of the future of your research? Again, it's not just the identifying the problems that need to be addressed, but it's trying to find those solutions. And maybe, Marcos, if I can just lean on you a little bit here, and if you can talk about that, the future of your research program.
So one major area that we'd like to develop are new tools to allow us to dissect the signaling pathways in the healthy and diseased brain. What parts of the brain are ill when we have diseases like Alzheimer's? What cells contribute to that disease process? What can we learn about how these cells talk to each other that may help develop not only new cures, which is, of course, ultimately the goal, but also means of alleviating symptoms now. So we need to have this two-pronged approach to diseases like Alzheimer's or ALS. We have symptoms now we must find ways to deal with while we think about ways to ultimately eradicate these diseases from the earth. So that's one area, is to develop these new tools. The other is to find other ways and other questions that these tools will allow us to answer. So as I said, there are fundamental questions about how the brain learns and stores information. We still don't completely understand that process, but the implications are vast about how we forget things. In cases of disease, why do we forget things? How is it that we're able to store certain memories but not others? Are there medications that can aid this process or hinder this process? So these are all areas that I'd like to see my research move into.
Excellent. So, Dedra, if you would give us a peek into your future and your research program.
Some of the things we would like to focus on are developing networks of clinics and clinical facilities, interested parties that want to work together to solve some of these problems that plague communities. So, for example, developing networks of critical access hospitals that function in rural communities where they may be the only source of care. Developing what's called a practice-based network, where we link providers that are working in rural communities or working with underserved communities. And by linking these kinds of facilities, we have both camaraderie and collaboration, but we also have larger numbers of people where we can study people in large populations and across a number of different geographic areas. We can look at rates of disease and rates of particular problems by where somebody lives or who their insurance type of insurance is, or whether they're male or female, or whether they're old or young. And that helps us develop strategies for improving health. So in short, basically extending the network of people and practices that are involved in the research enterprise. I think the other thing for the future is that we have to diversify the workforce, the scientific workforce, because a few years ago in this country there were more babies born to non-white mothers than white mothers. And now that tells you that our society is changing rapidly. And workforce development has not addressed that issue. And workforce development includes clinicians and basic science researchers and epidemiologists and sleep researchers and the whole gamut. We're all part of the scientific workforce. And the workforce has to change, because when you bring in people from underserved populations, people of color, they change the dynamics. They ask different questions, they get different answers, they have different connections to the communities. So we're a society that is in rapid change, and we need to train these people to go into our communities. And that's something I've been involved with, and I think it needs to be a much expanded and supported effort.
Excellent. Thank you. Hans.
Well, Dedra mentioned networks, and when I think about networks, I think not only about the clinics and the groups we can connect together, but also about the networks that I've have the privilege of building up over the years of former trainees that have found a place elsewhere in other labs, or sometimes are still in the lab and have built out their own research programs. I'm thinking about all the international collaborations that I've had the privilege to build up. And when you say, what does the future look like, I have to be careful not to get carried away, because yeah, here we go. the possibilities are endless. But I'll give you a little bit of a snippet of some of the things that are on my mind right now that are very exciting. So just last year, or just earlier this year, we published the first research where we've been able to get, through new technologies and collaboration with the University of Surrey in the UK, to get a glance at the biological clock, not only as it occurs in the brain, which we've known for a long time, but now we can see that the rest of the body has their own biological clocks. The digestive system has its own biological clocks, and it desynchronizes, it mismatches with the clock in the brain. And we now start to understand that is one of the reasons why people who are night workers have increased risks of metabolism. And the mechanisms by which this now occurs are within reach. We can almost already see it, and I've collaborations with UCLA and with other institutions across the nation and elsewhere, where we start to look at the hormonal mechanisms that make this happen, but also the environmental impact of why the exposure that people have to, for instance, different food patterns or feeding patterns that as they are on different schedules, and how that impacts their long-term health. With the College of Pharmacy here on campus, we're starting to see that same story develop into an increased risk of cancer, and we now have a bit of an understanding of the cellular mechanisms that make this happen, and also how we can then intervene, what we can do in terms of drug treatment or just behavioral interventions on trying to prevent those issues from happening. So that's very exciting. The other thing that is, to use a technical term that's really cool, is we're starting to get better insight into why it is that people who are sleep deprived sometimes make really bad decisions. And I'll leave that story for another day, but by understanding that, we can also help people to make better decisions when they're sleep deprived, when they're not getting enough sleep. And that is relevant to pretty much everybody, whether it's in an academic setting or whether you're in a law enforcement or in a military or emergency response or operating a plant. Everybody who's up at night or works long hours or otherwise doesn't get enough sleep shouldn't have to be making bad decisions simply because they're not getting enough sleep. And we think we can start to make a difference there. So that's exciting.
There's no end of good work to be done in all of these areas. John, maybe if you'll wrap us up with...
Sure. Thanks, Daryl. There's a couple things. One is the relationship between pain and addiction, especially opiate addiction. If I fall down and break my wrist, which I have, and I go to the ER and the prescriber gives me an opiate, I'm taking that opiate to get rid of the pain. But for some people, sometimes it's almost as if a switch flips in the brain, and now I'm embracing the notion of pain to get the opiate. And that's a perplexing relationship to me, and I think that's got real potential to help a lot of people. And it would be at a foundational level with people like Marcos. Could have some interesting implications for sleep and certainly implications at the epidemiologic level. The other thing is we are in the midst of this horrific opioid epidemic. My concern is that once we address that, we will soon be in the midst of another horrific epidemic with something besides opioids. And I think we need to really try to understand what is usually called the social determinants of health that enable these sorts of addictive disorders to take root and flourish. And so I am really interested, again, this is work that Dedra's team and our team often do in collaboration, understanding those environmental aspects that promote this sort of an unfortunate situation.
So thank you for joining us today. I think you've heard a little bit about some very impactful research being done by 4 highly successful researchers who are truly making a difference and an impact, a positive impact on our society. Thank you for joining us for Health Sciences Update.